Evidence-based medicine. Very important in the world today, evidence of what you're claiming. But what does the evidence say about the synthetic drugs? Now let's discuss evidence more, evidence-based research. We need to be able to understand. It's very important. What is it? Why does it matter? Well, of course it matters. You see, evidence-based practice means that in your practice, a professional is integrating the best research and expertise for patient values. Now, we got to deal with the research. It's very important. There must be research. You have to know how to find it, look at it. And then the next thing that's important is the patient values. The research is not our guide. The patient's intent, patient values are very important, as is the therapist. You, the therapist. What you are thinking here. Let's not forget the patient values. The patient values are very important because they might not want unnatural synthetic compounds. You see, they might be a little bit smarter than that, and they might want something more natural, but there still is a need for evidence. Well, the big question is, why are there so little natural medicine studies? Well, that's a question that Big Pharma doesn't want to answer.
I have to answer that question.
I'll answer the question. You want answers?
I think I'm entitled to.
You want answers?
I want the truth!
You can't handle the truth!
Transference is inevitable, sir. Every human being has an impact on another. Why don't we want that in a patient-doctor relationship? That's why I've listened to your teachings, and I believe they're wrong.
Yes, the teachings are wrong. Healing compassion of a doctor should be emphasized, not ignored. The healing force of nature should be first, not ignored. Nature heals, not synthetics. And the powers of the mind need to be taught to all doctors, along with humility and reverence for the natural process.
When we look at how we conduct medicine now and what evidence-based medicine does right now, in terms of statistics and randomized controlled trials are king, right? So that's the objective, that's the real thing. Where we minimize bias and we take the healthcare professional out of the equation.
They take the healthcare professional out of their testing because they want to see if the synthetic drug works. That's their big concern.
A doctor's mission should be not just to prevent death, but also to improve the quality of life.
Now, isn't that amazing that in the kind of academic world and in the research world, we're really doing all our best to take the observer out of the equation, and we do our best to take the individual and the healthcare professional out of the equation, whilst actually the patient is exactly looking for that. So this is kind of a world completely wrong side. So
You treat a disease, you win, you lose. You treat a person, I guarantee you'll win. No matter.
What was the definition of evidence-based medicine? And I realized, wow, it doesn't say that, there's the ranking of randomized controlled trials are best, and then the observational studies and case report is kind of lowest.
Testimonials are not validation. We have to go beyond that. We do need to have evidence. We need to look for evidence. We have to recognize that stories were told over the campfire for years and years. But those stories, they're not verification. They're not validation. We need evidence. It's very important.
What is it really that makes that difference? And it seems to me that randomized controlled trials meet scientific standards, but they kind of miss the patient's interest. So I wonder, when looking at that definition of evidence-based medicine, we can actually and should actually include and do these things with the interest of the individual patient in mind. So having the individual patient in mind now, they look for, connection, and that's what we look for. So there's this discrepancy between evidence-based medicine and what we actually experience as clinicians at the bedside.
They want to remove the doctor from these studies because certain doctors are better. Certain doctors have more compassion, more understanding. That's because they're not taught compassion. They're not taught understanding. This is what we need to now do, is to revise our education process to center around compassion, happiness, communication, understanding. And then put the doctor into the loop and let him do what he can to maximize healing.
So I wonder if there's time to expand the concept of evidence-based medicine to actually come back to the point of including the individual's needs. So if you like, patient-required outcome measurements rather than kind of scientifically meaningful outcome development measurements.
The emphasis needs to be taken away from whether the drug works or not on its own to more, is the patient getting better? Are we healing? Is there better results for the patient? Is the patient happier? Is the patient healthier? Long-term results, not side effects from synthetic drugs. It's not just the science. People's values are very important, but you have to know what is the evidence. Now, here at Immune, we have the world's largest collection and the world's largest library of natural and energetic medicine. Extreme evidence. Hundreds of articles about our machine and our technology. All of the energetic medicine. You need to know how to get it, how to find it, how to present it. It is not your God, but if you have no evidence, you're going to have problems. We must be able to find the evidence. Validation and verification of claims is the law. We have validated and done our claims for over 25 years. This is an old picture. For 25 years we've been doing this. Now, to the drug companies, they center around patents. They center around unnatural agents. In order to get a patent, you have to prove your compound is unnatural. You can't patent anything natural. And all of a sudden, the pill generation exploded.
This is the sound of a human heart. It will beat 72 times in this minute. Every beat can be a painful throb if you have a headache. This pain remedy is Bufferin, the one doctors recommend by name more often than any other leading brand. Take 2 Bufferin.
Back in 1985, I became the enemy of the chemical companies when I wrote a book proving that the synthetics were not compatible with the human body. And here's item 4 about side effects dominating. Let's take a look now into the world of side effects and just see what we can see, what the drug companies now have to do in order to tell people about the side effects. In 1997, they were allowed to do it on TV. Here is but a few examples.
Some people have had changes in behavior, hostility, agitation, depressed mood, and suicidal thoughts or actions while taking or after stopping Chantix. If you notice agitation, hostility, depression, or changes in behavior, thinking, or mood that are not typical for you, or if you develop suicidal thoughts or actions, stop taking Chantix and call your doctor right away.
Now there's so many medicines. They got this prescription stuff that they advertise on TV, and I swear half the time the side effects are 50 times worse than what the medicine cures.
Doctor if you have high fever, stiff muscles, and confusion to address a possible life-threatening condition, or if you have uncontrollable muscle movements, as these could become permanent.
Like try new FloraFlor. For itchy, watery eyes, it's FloraFlor. Side effects may include nausea, vomiting, water weight gain, lower back pain, receding hairline, eczema, seborrheic psoriasis, itching, chafing clothing, liver spots, blood clots, ringworm, excessive body odor.
High blood sugar has been reported with Abilify and medicines like it. In some cases, extreme high blood sugar can lead to coma or death.
Uneven tire wear, pyorrhea, gonorrhea, diarrhea, halitosis, scoliosis, loss of bladder control, hammer toe, the shanks, low sperm count, warped floors, cluttered drawers, hunchback, heart attack, low resale value on your home.
Other risks include decreases in white blood cells, which can be serious, dizziness upon standing, seizures, trouble swallowing, and impaired judgment or motor skills.
Feline leukemia, athlete's foot, head lice, clubfoot, MS, MD, VD, fleas, anxiety, sleeplessness, drowsiness, poor gas mileage, tooth decay, parvo, warts, unibrow, lazy eye, fruit flies, chest pains, clogged veins, hemorrhoids, dry heaving, and sexual dysfunction.
Prescription Maripex may cause you to feel drowsy or fall asleep during normal activities such as driving, or to feel faint or dizzy when you stand up.
I'm watching it going, you know what, I'll just have itchy, watery eyes.
Or if you experience increased gambling, sexual, or other intense urges. Other side effects include nausea.
And that, as much as anything else, led to my drinking problem.
Serious side effects include a tear in your stomach or intestine, and can also include symptoms of opioid withdrawal. Common side effects include stomach pain, diarrhea, nausea, gas, vomiting, and headache.
Phena is not for everyone and may increase your risk for uterine cancer, strokes, or blood clots, and should not be used in women with these conditions or any of the following: unusual vaginal bleeding, heart attacks, severe liver problems, pregnancy, or breast cancer.
Abnormal behaviors may include aggressiveness, confusion, agitation, or hallucinations. The temporary inability to move while falling asleep or waking up and temporary leg weakness have also been reported. In depressed patients, worsening depression, including risk of suicide, may occur.
Tell your doctor right away if your depression worsens, you have unusual changes in behavior, or thoughts of suicide.
But enough about me. I hope this hasn't been boring for you. It's just that whenever I start to talk about Elaine, I always get so carried away. I lose all track of time.
May cause serious or life-threatening side effects. Call your doctor if you have confusion, sweating, fever, or stiff muscles. Call your doctor if you have trouble breathing, swelling, dizziness, fatigue, or irregular heartbeat. Don't drive or operate heavy machinery.
Tom, take it slow.
Hey, stop.
The vaccines!
High doses may cause mental problems. Talk to your doctor if you become depressed or have thoughts of suicide.
Well, I could go on for hours, but I'd probably start to bore you. You know, I really couldn't blame Elaine. She wanted a career.
In patients with type 2 diabetes, weight loss may cause low blood sugar. Stop taking Belviq and tell your doctor if you have prolonged erections or your breasts begin to make milk or increase in size. Belviq may decrease blood cell count. Common side effects include headache, dizziness, fatigue, nausea, dry mouth, constipation, back pain, and cough.
Side effects may include headache, upset stomach, delayed backache, or muscle ache. To avoid long-term injury, get medical help right away for an erection lasting more than 4 hours.
If erections last more than 4 hours, you might have some troubles.
If you have any sudden decrease or loss in hearing or vision, or any allergic reactions like rash, hives, swelling of the lips, tongue, or throat, or difficulty breathing or swallowing, stop taking Cialis and get medical help right away.
What?
One ingredient in Contrave may increase suicidal thoughts or actions in some children, teens, and young adults in the first few months.
When they built those roads, they had no thought of drainage in mind. So we had to take a special Jeep up to the main road. In fact, we were lucky to even get a Jeep, since just the day before, only one that we had broke down in a bad accident.
Serious side effects are mood changes like depression and mania, seizures, increased blood pressure or heart rate, liver damage, glaucoma, allergic reactions, and hypoglycemia. Not for patients with uncontrolled blood pressure, seizure history, anorexia, bulimia, drug or alcohol withdrawal, on bupropion, opioids, MAOIs, allergy to the ingredients, or pregnant.
Would you go up, please?
May cause nausea, constipation, headache, and vomiting.
Oh, man.
Don't stop taking Eliquis unless your doctor tells you to, as stopping increases your risk of having a stroke.
Call your doctor if you have unusual changes in mood, behaviors, or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults.
Call your doctor if you have unusual changes in mood, behavior, or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults.
Elderly dementia patients taking Latuda have an increased risk of death or stroke.
Elderly dementia patients taking Seroquel XR have an increased risk of death. Call your doctor if you have fever, stiff muscles, and confusion, as these may be signs of a life-threatening reaction.
Call your doctor if you have fever, stiff muscles, and confusion, as these may be signs of a life-threatening reaction. Or if you have uncontrollable muscle movements, as these may become permanent. High blood sugar has been reported with Latuda and medicines like it. and in some cases, extreme high blood sugar can lead to coma or death. Other risks include decreases in white blood cells, which can be fatal, dizziness upon standing, seizures, increased cholesterol, weight gain, increased prolactin levels, impairment in judgment, or trouble swallowing. Avoid grapefruit and grapefruit juice while taking Latuda. Use caution before driving or operating machinery.
Ruptured spleen, sometimes fatal, as well as serious lung problems and allergic reactions have occurred. In patients with sickle cell disorders, serious, sometimes fatal crises can occur.
Stop use if you develop severe watery or bloody diarrhea or severe abdominal cramps, as these may be fatal.
And eating or driving while not fully awake with memory loss for the event, as well as abnormal behaviors such as being more outgoing or aggressive than normal, confusion, agitation, and hallucinations may occur. Don't take it with alcohol as it may increase these behaviors. Allergic reactions such as shortness of breath, swelling of your tongue or throat may occur and in rare cases may be fatal. With depression, worsening of depression, including risk of suicide, may occur.
All prescription NSAIDs, including Celebrex, may increase the chance of heart attack or stroke, which can lead to death.
Driving, eating, or engaging in other activities while not fully awake without remembering the event the next day have been reported. Abnormal behaviors may include aggressiveness, agitation, hallucinations, or confusion.
Don't pay any attention. It's a cheap trick.
Alcohol or taking other medicines that make you sleepy may increase these risks. In depressed patients, worsening of depression, including risk of suicide, may occur.
Or if you have uncontrollable muscle movements, as these could become permanent. High blood sugar has been reported with Seroquel XR and medicines like it, and in extreme cases can lead to coma or death.
Intermezzo, like most sleep medicines, has some risk of dependency.
Can't kill Saint-Jacques. Death on a leaf! Come on!
Kylena does not protect against HIV or STDs.
Side effects may include dry mouth, insomnia, sexual side effects, diarrhea, nausea, and sleepiness.
My heart doesn't pump enough blood, so my doctor gave me Farxiga. It helps I take if allergic to Farxiga. Symptoms of a serious allergic reaction include rash, swelling, difficulty breathing or swallowing. Stop taking and seek medical help right away.
Tell your doctor right away if you have red color in urine, or pain while you urinate, or a genital area infection, since a rare but serious genital infection may be life-threatening. Do not take Farxiga if you have severe kidney problems or are on dialysis. Other serious side effects include dehydration, sudden kidney problems, genital yeast and bacterial infections in women and men, urinary tract infections, and low blood sugar. Stop taking Farxiga and call your doctor right away if you have symptoms of ketoacidosis, which is serious and may lead to death.
Serious side effects may include pancreatitis. Tell your provider about vision problems or changes. Taking Rybelsus with a sulfonylurea or insulin increases low blood sugar risk. Side effects like nausea, vomiting, and diarrhea may lead to dehydration, which may worsen kidney problems.
Ah, there she is, beautiful and alive. Yes, she's back on the job, envied by all. She's happy and beautiful because she's taking Pimimoracil. Side effects include renal dysfunction, urinating, testicular bleeding, chronic acid inflammation, burning hemorrhoids that feel like they're trying to put a forest fire out in your ass. Feel inflammation until you need to get 2 sizes larger shoe, ringing in your ears, loss of hair, skin eruptions, bad skin eruptions that are really bad, attack of attention, loss of attention, all these different things, backache, extreme vaginal itch, I mean really bad vaginal itch, and hair loss. But it's okay. Now she's rich enough to buy a wig.
Oh, come on, that's funny.
Well, Big Pharma's little secret, not just the side effects, but people die during the testing, massive quantities of them. They're hurt during the testing. We all know this. It's all around us. We all know, and the only way to stop the side effects is to not take the drugs. So after having given this proof of becoming an enemy of the drug companies, I now offer you a more substantial proof.
Transference is inevitable, sir. Every human being has an impact on another. Why don't we want that in a patient-doctor relationship? That's why I've listened to your teachings and I believe they're wrong. A doctor's mission should be not just to prevent death, but also to improve the quality of life. That's what